Good afternoon, class. We're going to jump in. I guess this is going to be chapter 3 in DeWar's textbook, and we're going to talk for a couple of sessions about just the demand for healthcare. And before we jump into that, and we're going to actually define what health is and talk for a few minutes about it, but I still want to go back and do a little review of kind of where we are so far. So far, we've gone through Arrow's article. We've talked about issues with U.S. healthcare. We've talked about a couple of different approaches on what healthcare economists do, and then what the economic aspect is. But as I want to still continue to try to impress upon you that we're trying to help you build a toolbox, trying to help you put that toolbox together. And hopefully that when you get out of Fisk with your graduate school degree, that you'll be able to go and work in the healthcare industry if you'd like to. A lot of what we're going to teach you as we continue to go forward applies to some other market economies if you decide to go in that direction, because what we're using as kind of the building blocks or the focus are just basic concepts that you learned in your, well, at least hopefully most of you learned in your microeconomics classes that you've taken. But again, I want to continue to stress the fact that if you go in the healthcare marketplace, there is that financial coin out there, and everybody is struggling to gain control of that financial coin. And as we go through this class, hopefully you'll be able to be a very productive member of one side or the other of that financial coin, whether you go to work on the provider side that's struggling to maximize revenues, or you're going on the health plan side, or maybe it's a government agency side that is struggling to minimize the healthcare expenditure. So again, both sides of that financial coin. And the one other thing that I'll keep harping on as we go through this class is, once you get into the market, if you go into the healthcare market especially, once you get into the market and your direct supervisor comes to you with an issue, or they want you to generate a strategy about something, and if it doesn't make sense to you, always follow the money. And we'll continue to harp on that as we go through the rest of these chapters, because hopefully it'll become apparent why that's important. But just to go back, and we talk about healthcare economics, and as economists, especially in the healthcare marketplace, we're analyzing, we're explaining, we're forecasting, we're predicting, we're prescribing. As I said, if you go in the private sector, you may work for a health plan, you may work on the provider side of the house. Maybe you get your graduate degree and you go to work for Meharry Medical Center. You can go to work for the government and a government agency. A lot of government agencies are looking for economists with an understanding of healthcare. You've always got CMS that manages the Medicare population, that manages the Medicaid population, at least at a high level. Or you can go to work for the state agencies, because Medicaid is basically a state-controlled healthcare program. So maybe you want to go to work for the state of Tennessee when you get out. You can go into consulting. You maybe want to be an entrepreneur. Maybe you want to develop a home health company. Maybe you want to develop and patent some type of healthcare technology or healthcare instrument. And then finally, there are a lot of vendors, especially in the Nashville area, that are providing goods and services, especially consulting type services, which is a little different than an independent consulting, but consulting type services on both the provider side and on the health plan side. So a lot of opportunities out there. And we talked about, I guess it was in chapter 3, maybe it was in chapter 2, we talked about just the demand for healthcare, just in general, the demand for medical care. And we talked about it was complex, it was random, it was uncertain, it was unpredictable, because when you seek medical care, you are seeking it's a desire to feel better, a desire to feel well. And then ulterior motive is also a component of one's ability to improve their health stock. And we'll get into definition of health stock in a few minutes. Also, what you're talking about is, when it's the demand for medical care, especially, there are certain issues or certain drivers in the demand and supply function both, and we call them demand shifters or supply shifters. And since we're talking about demand for health today, we're going to just touch briefly, just help you review the demand shifters. And when I say demand shifters, if you're looking at just the ordinary demand curve and you're talking about quantity demand, and again, it goes back to your micro classes. If you're talking about the quantity demanded, everything's held constant, really, except price. So you're sliding up and down that demand curve, and at different prices, you get different quantities demanded of whatever that good or service is. And economists, because it is such a complex environment that we have to focus in, they are invoking ceteris paribus, and it's Latin for all other things equal or all other things unchanged, because what they want to do is they just want to focus, at least to explain and help predict what's going on. They want to focus just on price and quantity. And they're trying to hold a lot of these other factors constant, factors like consumer preference, prices of related goods, income levels, demographics. And then maybe most important of all is, especially on the demand side, is buyers' expectations. Buyers' expectations, and especially when you're talking about your health status or your health stock, it's what is your expectation of that health status or health stock. And then kind of to wind things up, we talk about the factors of production. We talk about what we're going to produce, how we're going to produce it, for whom are we going to produce it, and how we're going to keep some of our capital stock and hold it in reserve to help ensure that we continue to produce going forward. Also, remember that the U.S. market is what we call a market capitalist economy. It's a free market. And with the exception of a little government invention, it's the free market that drives the prices and quantities of goods and services either bought or sold in the United States. So, and if you think about healthcare, it is somewhat of a free market. We do have government intervention at, at federal, at state, at local level when it comes to healthcare, whether it's, it's Medicare through Medicare Advantage, whether it's Medicaid. There are just a lot of programs for the indigent community health centers that the government dabbles in, and they think they know how to more efficiently provide healthcare goods and services, and maybe they provide, the private sector does. At least that's the government's idea of the whole process. And then lastly, when as you think about, if you want to go into the healthcare marketplace or the healthcare environment, you want to think about, as you go into it, do you want to go, again, government? Do you want to work private sector? If you work private sector, you like on the provider side, you're on the health plan side. But it doesn't matter where you end up in the healthcare marketplace, or for that matter, any other marketplace, you always need to remember the kind of the underpinnings or the building blocks of economics and what differentiates economics from your other social sciences. And that is, economists are concerned with opportunity cost. They're concerned with self-interest. And when we say self-interest as an economist, we're thinking about optimization. On the provider side, you're trying to optimize revenues. On the health plan side, you're trying to minimize expenditures. So maximizing revenues, minimizing expenditures, those are different forms of optimization, depending on what side of that financial coin you fall on. And then lastly, economists make decisions, not only economists, but consumers just in general make decisions at the margin. And as you get into an analytical role, especially in the healthcare marketplace, you're going to be looking at things. You're going to be looking at consumers may buy certain healthcare goods and services, or certain medical goods and services, or health promotion type products, as long as the marginal benefit's greater than the marginal cost. And if you're on whether you're on the health plan side or the provider side, you're going to continue to generate goods and services to a consuming population as long as the marginal revenue is greater than the marginal cost. So again, making decisions at the margin, and that's what we're talking about from an economic perspective. And we'll kind of jump in, and the first thing you ask yourself is, kind of what is health? And I guess the basic is we're all born with a certain level or certain base of health capital, health stock, health status as a newborn. And then as you go through, your newborn life and, childhood and your teenage years and the young adult, and as you start to, like some of us start to age, what happens is that health stock starts to deteriorate. And or you might think of in financial terms that, it starts to depreciate. Just like you buy a new car, it's a depreciating asset. You buy a new car, you drive it off the lot, and the minute you sign that paperwork and drive it off the lot, it starts to depreciate. Well, healthcare, and especially your health status, is somewhat similar in that as you get older, your health status, it's just a fact of aging. At least in the current environment, it's a fact of aging. It just starts to depreciate. And when we talk about good health, we're talking about, and Dewar gets into it in her text, it's talking about the quality of life, or, and not only quality of life, but how productive you are. And good health not only accounts for quality of life and your productivity in your lifestyle, but maybe it has a significant impact depending on what your occupation is. Maybe it has a significant impact on your income. And again, everybody is born with this, stock of capital health. And what we try to do through good health is we just try to maximize the number of healthy days. And so you've got good health. And if you talk to your local health plan, they are driving things like population health. If you're in a Medicare population, they've got a program called Silver Sneakers where you get free membership to a gym. Most health plans have what they consider a health coach that you can reach out and talk to and talk about what you can do to help improve your health status or to somewhat minimize the deterioration of your health status as you get older. And just like I worked at Blue Cross Blue Shield, was the last health plan that I worked for, and we had a app on our cell phone, and it was called Wellvy, was the application. And then so they would, reach out and they'd send you text and they'd send you emails and said, hey, have you walked 10,000 steps today? Or, hey, it's time for you to go to the doctor, or hey, are you eating healthy? And what they were doing was they were trying to help you through not so much medical care, but through just the act of being healthy, trying to help you gain more healthy days. And again, talking about diet and exercise and sleep and lifestyle and clean air. And, did you have access to medical care if you needed it? And, constantly especially with this Wellvy, they were always doing surveys and, do you smoke? Do you chew tobacco? Do you, drink alcohol? Do you exercise? And constantly reminding you of things that either you shouldn't be doing or things that you should be doing to help potentially increase the number of healthy days in your lifestyle. So that's kind of what the health plans are doing, because the health plans know that the healthier the population is, the less drain on the healthcare system it's going to be, especially the medical care system. And so you've got good health, you've got medical care, and Dewar kind of says good health plus medical care equals health care. So on healthcare services, it's basically there, the combination is there to alter and improve health. And how they provide us is, the actual access to goods and services within the healthcare system. And as we talked about, demand for health with healthcare as an input for production and healthcare is as you treat healthcare as a good, health as a commodity, healthcare as a means to create it. And at the end of the day, what we're after is to relieve pain and to feel better. So if you have done everything you can to optimize your health status and you still have issues, maybe you were born, maybe you're born with allergies and you have issues with allergies, maybe you're born with asthma, and good health is going to help that to a certain extent, but you're always going to need some level of medical care because you want to go in to see your physician or you want to go in to see your allergist, because the desire is to maximize your utility as a consumer of feeling better. So that's why you actually seek health care or seek medical care, to help the combination of improved health plus medical care to improve the number, or the potentially improve the number of healthy days you have. And if you're looking at healthcare, it's, basically it's a production function. It takes scarce resources. Especially if you're looking at medical care, the scarce resources, if you think about, go back to your basic micro classes, you've got labor, you've got doctors, nurses, technicians, lab techs, physical therapists, you've got capital stock. If you're thinking about across the street at Meharry Medical Center, you've got the capital stock there in terms of machinery, you've got lab, you've got radiology, you've got the building itself, you've got natural resources, and natural resources where Meharry is concerned is the land that the medical center is built on. And then you've got the technology and the production and the entrepreneurship that's embedded in the way that Meharry provides their goods and services, that consuming population. So that's the way it all rolls up into this production function to provide the medical care goods and services that I'll use the collective we, that we need to ensure that we can maximize the probability of those healthy days. And then one last thing she talks about before we move on, she says, health is not a tradable commodity. Healthcare is derived via demand for health. It's not pleasurable, but it's purchased to improve your overall health, and improve the number or the probability of the number of healthy days that you have as an individual. And as you're also trying to maximize your health status by minimizing the depreciation of your health status as you go out over time, as we all get older. That's going to kind of wrap it up as far as what Dewar thinks about her definition of health. And when we get back, we're going to spend a few minutes talking about kind of the quote investment model for health. Thanks everybody for joining, and I will talk to you in a few minutes.